Get it. Okay, so we're going into large intestine meridian, running through here, which is Yang Ming. Yang Ming is the energy of the sun. Sun bright, it means young sun bright, and it's a blood meridian, which allows energy and the body to open. And this, of course, this compression here, ironically affects the median nerve. It affects the brachial nerves and the ulnar nerves. So we're next going to look at the palmar ligament. The palmar ligament on most of these people, the wrist is very, very tight and the carpal bones are compressed. If you were going to look at the idea that this nervous system is affected by the chi, or that the nerves themselves or the blood supply themselves, these things are all critical, because having a tourniquet on this section here affects the energy into the hand energy being blocked affects the energy going back into the body, and the flow of the energy must go back and forth. And so, looking at this as a whole, you can see the compression here of the pectoralis into the pectoral, the delta pectoral groove running in here, adversely affects the energy running into the hand from the Western standpoint, but further, the acupuncture meridians running through the entire section of the body into the hand and into the head. This is all, the body is one. So if this is blocked, the body's blocked. Lift your hand up and push. 1, turn your wrist. 2, turn your wrist again. 3, drop. So as I'm working, I'm actually going to get onto the point of the heart. In acupuncture, these meridians, ironically, parallel with muscle compression points as well. So there you see compression point into the joint of the pectoralis major and pectoralis minor going from one point to the other. You have minor going into the coracoid process and major running into the glenoid area into the pectoralis delta pectoral groove. And so I'm going to actually put pressure on both of them. I'm going to put pressure on the heart, actual acupuncture meridian. Pull your shoulder blade back. Deep breath. 1, 2, 3. Lift your arm up high. 4, 5. Head up. Yawn. Drop. Now, the funny thing about this is that whenever the hormones of the body start to respond hormonally, the muscles respond as well. And so, ironically, I have found that by opening up the energy as I'm doing, I'm actually just gently rolling through the biceps brachii, coracoid brachialis, and biceps brachii, and the deltoid, and running right down the deltopectoral area, and also into the tissues. Lift your hand up high, drop. Ironically, as I work, I can feel things popping apart and loosening. And this, of course, is this increase of energy, increase of blood flow, increase of the nervous system functioning properly. Lift your hand up high, drop. And lift your fingers and hand up high, drop. Now, because the joint is three-dimensional and the rib cage is three-dimensional, you have to treat this in a three-dimensional fashion. But it would be wrong to not realize that these meridians being blocked has 100% to do with why this does not get well. Okay, so again, this is the palmar ligament. I'm holding it tightly. She tightens her hand around my wrist and holds it. 1, deep breath. 2, inhale. 3, exhale. 4, and drop. And then I take the hand and I start to pull right through the brachioradialis, and I'm pulling right into all of these pollicis longus, and stretching and pulling and stretching and pulling until I feel this plexus right here open, these carpal bones open. Open your hand again, wiggle your fingers, drop. And stretching it, relax your arm. And when people are really tight and have been tight for a long time, they really don't even know they're tight. They have no other concept, and so you have to even encourage them further to breathe more, to relax more, because you're actually changing positioning, you're changing function, you're changing the actual ability of the body to stretch and move. And so you have to get their mind on board as well to relax even further, so that you're going to be capable of affecting more change, because oftentimes people are unconsciously holding that position